About a year and a half ago, I was coming out of a store. I didn't see a step, and I fell forward. I put my right hand out to protect me, and I dislocated it very badly. I went to the emergency, and they popped the shoulder back in. And then I went to my doctor, and he prescribed painkillers, and he prescribed some sort of activity.
Laurie's shoulder problem still has a serious because the shoulder ligaments, the adhesion together in the shoulder socket. So that's why when he came in, so cannot move at all. So I'll give the examination and find out the biceps, long heads, biceps, short heads, and other ligaments. The condition is poor and also very tense.
Before I had acupuncture, the doctor had told me that my shoulder would not get much better. That if I wanted to improve it, I'd have to get another operation. And he wasn't even too sure if that would be effective or not.
After more than 10 treatments, the Laurie's shoulders pain much reduced. So far, he can move by himself. At least the abduction can reach the 75 degree.
They started working on giving me acupuncture to help my shoulder. And since that time, I've been able to raise my shoulder, and it's getting better little by little.
The acupuncture speed up the blood and 7 times than the original level, and also break the stagnation and speed up blood and bring the blood flows to the shoulder area, which help the recovery faster. After acupuncture treatment, the recovery and the course much shortened. So except this, patient has diabetes, hypertension, COPD problems. So there's a kind of compound disease, and it's also bother his health. But overall, we give the acupuncture treatment, the pain reduced, and that surrounds the shoulder and the problems. After needles, we should do tuina. Tuina manipulation also in the speed up the blood, move the blood and the qi, which is also increase blood flows in the shoulder. So that's why we suggest use acupuncture, tuina, and plus physiotherapy. That's much help for the patient recover.